Thank you, Sri. So,
Extremely sorry for the technical glitch caused. Over to you, Sharon.
okay, thank you, Sripriya. So, today's session will be taken by Dr. Abhijith Dam. He's a professional who completed his MBBS with honors from RG Kar Medical College, Kolkata. He's an MD, FCCP, FPM, MSc Palliative Medicine from Cardiff University. So, he's the medical director, Koshish, the Hospice National, Koshish the Hospice, and he's the national president of NAPC AIM. After that, I think he has completed his MD in anesthesiology from All Indian Institute of Medical Sciences, New Delhi, in 1995. Fellowship in palliative medicine from Poland and Connecticut, India. Fellowship in interventional pain management and masters in palliative medicine from Cardiff University. He has also done a course in advanced Vedanta, care of the elderly and contemplative practice in end of life. He has extensive experience in the fields of anesthesiology, critical care medicine, pain medicine, and palliative medicine. He is a national faculty of the Indian Association of Palliative Care. He has been associated with Koshish, which is an NGO providing palliative and supportive service in Jharkhand, Bihar, and West Bengal. His current passion is developing a long-term care facility for the elderly and terminally ill, providing holistic care, which is nearing completion. This is the introduction of Dr. Abhijith Dam. As you know, he is an expert in this field. So, sir, I invite you to take the class.
Okay, thank you. And hopefully I'm audible.
Yes, sir. Perfect.
Okay, I'll start the screen share and there you go. So my screen, hopefully it's visible.
Yes, sir.
All of you. Okay. So this actually is not a very, what I would say, very good time to discuss a topic like spirituality and religiosity, especially in the post-lunch session when you're all feeling sleepy, perhaps. But then we shall go ahead and I shall try my best to do some justice. Wherever we go, we being humans, you know, we look for certain commonalities, anything in common, like, you know, because commonalities are things which bind us. So amongst all the participants who are here today, there is one commonality amongst all of us. And that commonality is suffering. Because all of us who are attending this session right now have suffered at some point of time or other. So suffering, you see, is a commonality again, which binds us all. And it is only when we suffer, we try to seek we try to make a sense of meaning out of our suffering. Because suffering without meaning actually increases the suffering. So whenever we try to give our suffering a sense of meaning and purpose, only then we can transcend our suffering, right? So suffering is a commonality. All of us suffer, which is fine. But that suffering has to have some meaning. It has to have some meaning, or you have to give it a sense of purpose. Only then that suffering can become meaningful for us. Right? It's a bit of a difficult proposition to start off with, but then as we go forward, I hope that even if my statements are a bit difficult to understand or contemplate right now, but by the end of the lecture, I hope it will smoothen out. So as I said, this is the nature of suffering. And whenever we suffer, we look for a sense of meaning or purpose, or we look for a sense of support. We seek support. And it is often during such times of suffering that we turn to religion or spirituality to help to make a sense of meaning out of our suffering. Illness is a spiritual event. You see, all of us have fallen ill at some point of our life, isn't it? Fever or whatever it is. It grasps person by the soul and by the body and disturbs them both. It raises troubling questions of a transcendental nature about meaning, value, and relationship. So illness is a cause of suffering, and especially if you're being diagnosed with a terminal condition or a potentially life-threatening or a terminal condition, then again that suffering escalates. And then again you look for a sense of meaning or purpose. And then you take the help of religion or spirituality. Now, if you look at this photograph, that elderly gentleman who is sitting on the bed, he has a terminal diagnosis. And that gentleman on the with the striped shirt who is offering him a glass of water is his son. His son is actually taking care of him. So that gentleman, that elderly gentleman suffering from cancer is actually quite fortunate, I would say, because nowadays in this modern world, you know, getting a caregiver is very often difficult. This lady in this red sari is his daughter-in-law. So this gentleman is actually very fortunate that he's being taken care of by his immediate relatives. Now, I would draw your attention to the background. If you see the background out here, you see photographs of family members, and of gods. Because now this gentleman is approaching his last days of life, and what actually gives him a sense of meaning and purpose is his loved ones, is his immediate family, and again religion. He has taken the recourse to religion to help him tide over such a crisis of suffering. And this is quite common. You see, you imagine yourself lying down on bed. Actually, if you just have a few days to live, and what would you look for? What would you do? Whom would you want by your side? So the answers would vary, but then that are your answers, right? So you would want somebody who, your friends or close relatives or whatever, your spouse maybe by your side. And you might want to go out into nature if you are an atheist, or if you are a believer, then you would want some religious figures to be around you or whatever. So the choice varies, but then these are very powerful instruments. Believe me, spirituality and religion, believe me, these are very powerful instruments which can help an individual tide over a crisis. We all have gone through such episodes in our lives, you know, especially during exams, before giving exams or before the results are declared. We would visit temples or mosques or churches. We make huge promises to gods and to ourselves, isn't it? Because those things, we also know that very most often that we won't be able to keep those promises or whatever it is. But for the time being, that gives us a sense of moral support. And that is what is important. I was a very strong atheist, believe me, till about 2011, before certain events happened in my life, which literally forced me to change my outlook. And today, in spite of being a medical doctor, I do very strongly advocate religiosity and spiritual practices to help tide over crisis. And not only that, I inculcate these practices in my medical practice. And I have seen so many patients benefiting out of such practice. However, it is seldom a medical man has true religious views because there is too much pride of intellect. So as we go on into science and the way science snobs down or looks down upon religion and spirituality and so on and so forth, that is not actually very fruitful. We need to have a holistic approach. Yeah, science has its own role, spirituality has its own role, religiosity has its own role, and together, if we move forward together, and only then an individual can benefit. The physician's own belief system, whether spiritual, religious, or none, affects medical decision making consciously or unconsciously. You have to understand one fact, that if science was perfect, if modern medicine was perfect, then nobody would be dying. But over the years, over the last 200, 300 years of modern medicine, what have we achieved? We have not conquered death. Yes, we have increased longevity. I would say that, yes, science has managed to increase longevity, but at what cost? It has also, in addition to increasing longevity, it has increased suffering. It has increased the cost of dying. People are now dying alone, in pain, hooked on to life-supporting equipments. And would you really want that type of a death? Would you prefer to die in a hospital, in an ICU? Because these have become the preferred places of dying. Most of you who are actually listening to this lecture, I see there are 54 participants right now. And believe me, more than 40 participants would die in hospitals, in ICUs, lonely deaths, undignified deaths, painful deaths. Because it is you who has brought it upon yourselves. Given a choice, where exactly would you like to die? If you had the choice. And what have you done to make that choice possible? The best part is that you really haven't even thought of that, because we don't think of dying. We put it behind because that is something which creates ripples in our mind. It disturbs us. So we don't want to think about that. But anyway, all said and done. So this is food for thought, actually. You really need to think about it, act upon it. Just not think, but once you think about it, and then you have to put something into action so that you don't suffer the same fate. Now, this is one of my favorite slides. This photograph is a mythological figure, the Varaha avatar, which would be at least 4,000, 5,000 years old, if not more. And you can see that it is holding up the earth on its snout. Now, when actually did modern science tell us that the earth was round? Hardly 300 years back. Modern science actually proved that the earth was round hardly 300 years back. But you see, our ancestors knew that the earth was round almost 5,000 years back, which is so very well documented in ancient art. So we have no reason whatsoever, no business whatsoever to mock upon other schools of thought. As I said, religiosity, spirituality, these are also equally important. And if modern science says that, this is all bakwas, no, then that is not done. That is the whole idea of holism, where you integrate each and every thought process which the patient and the patient's family values, right? Because we have no business in implementing our own ideas into the patients' minds or the patients' families' minds, because they are vulnerable at that point of time. So whatever their belief system is, we need to respect that and support it and integrate it as far as possible in our clinical practice so that the patient and the family is benefited. Now, the light which we see, the visible light, is only 2%. That doesn't mean that 98% of the light, which is in the invisible range, doesn't exist. It does exist. What we are seeing is only 2%. But 98% is still there, which we can't see. And that is something which we should be mindful of. So just what we are seeing is just the tip of the iceberg. It's a grievous mistake to keep a wall of separation between medicine and religion. The act of healing is the highest form of imitatio Dei, the imitation of God or godliness. So the act of healing, we need to be healers and not just treaters, because most of the modern doctors today are treaters, sadly so. The moment we go to a large hospital, you're hardly touched, you're hardly listened to. You're given a battery of tests, and based on those tests, technology diagnosis, whatever, based on certain algorithms, you're labeled with a diagnosis. But then what the technology is forgetting, that you are a human being with certain likes, with certain dislikes, right? That you have feelings, you have emotions. So that is the essence. And only when when you address those factors also, that you are somebody's son, you are somebody's husband, or you are somebody's daughter, and so many people actually love you, know you in a better way, that you can understand the whole essence of healing. Otherwise, what you're doing is just treating. You have fever, I'll give you paracetamol. That is treating. But if you remember your mother, when you had fever, your mother would take you in her lap and gently, run her fingers through your hair and sing a lullaby for you and gently massage your forehead, and your fever would disappear. Your mother was a beautiful healer. Modern medicine is just a treater. Now the choice is yours. What do you want to be, a healer or a treater? And then this little girl, she was one of the greatest teachers for me. This little girl, if you watch her forearm here, there's a huge growth, right? She had a particular type of cancer called Ewing sarcoma. And every day, not every day, whenever she used to come down to my clinic, she would sit with her eyes down, with her head bowed and her eyes down. She would not look up at me. She would not speak to me. And one fine day, I decided, no, that today I will not let her go just like that. I have to speak to her. And I purchased this huge box of chocolates and gave it to her. And she continued to hold the box of chocolates and looking down for quite some time. And then finally, almost 15-20 minutes later, she gradually lifted her head and looked up to me. And those were the most beautiful eyes that I've ever seen till date. And then I started talking to her. And then I asked her, why do you cry so much? Does it hurt you? Does your tumor, does your hand hurt? And then she told me, no, it doesn't hurt that much. But when I see my mother crying, looking at me, that time even I start crying. And I was like shocked, because I never imagined that such a little girl would have such a huge, pattern of compassion for her mother, because she was seeing her mother suffering before her. And in spite of her own pain, she was more concerned with her mother's suffering. So as I said, what we see, this is what we see is just visible light, 2%, but then 98% is still there, is still out there. And the whole essence of good palliative care is to find out that 98% also and address that 98%. Now, what exactly is religion? Religion comes from the Latin word religare, which means to bind together. So now we have, as I see, we have 61 participants. So all of us, all the 61 participants, if we come together and say, okay, we will form our own religion, we will call it XYZ. And these are the rules of XYZ religion. So a new religion is formed. So who formed it? All the participants formed it. So basically, religion is something which is basically man-made. We create a religion. When we get together, we sit, we decide upon a particular rules, regulations, the modes of prayer, and so on and so forth. And that is called a religion. It is a structured belief system that addresses universal spiritual questions. Right? So it is basically man-made, which is a structured belief system that addresses universal spiritual questions. And religious rites and rituals provide a concrete way of expressing spirituality. It can be corporate, it is structured, it is organized. So that is what basically is religion, right? And what is spirituality? Spirituality is anything which gives you a sense of meaning and purpose to life. Many times you would wonder, why am I alive? What is the point of living like this? And then maybe you would say, no, my son is still a little boy, or I have a little daughter. I have to take care of that little daughter. So I have to be alive. So that is your spirituality then. So what becomes your spirituality? Your little daughter. Or maybe your dog. Or maybe your pet cat. Or maybe you love nature, watching a flower blossom. That is your spirituality, because that gives you a sense of meaning and purpose. So spirituality doesn't mean that it has to be religion. Spirituality can be anything. Anything which gives you a sense of meaning and purpose in life is your spirituality. Today, maybe your spirituality is based on the love of your little child. And tomorrow, when your child gets married off, grows up and gets married off, then your spiritual things can change. Spirituality can change. Spiritual issues often surface during end of life. Spirituality is something which is inbuilt in you. Every person is spiritual, but not every person is religious. Religion is something which you create, or you voluntarily or by birth, you are put into a particular, or you have to accept certain religion. Then you can change your religion also. But spirituality is something which is already inbuilt. That is the software with which you are, that is the inbuilt software which is given to you by God. Now, here I will give you an example of religious pain. So there is something called religious pain. There is something called spiritual pain also. So religious pain, I'll give you an example. Now, this gentleman had cancer of his lungs, and quite advanced cancer. And this lady in this orange sari is his wife, and that is his daughter. And this is our nurse, right? Now, this gentleman otherwise had pain, physical pain, which was very well controlled by our team. But he always had this sense of apprehension. Because in addition to his daughter, he had a son also. Now, the father and son had a fight, and the son was staying away from the father. Since the last 3 to 4 months, he was staying somewhere else. Now, this gentleman was so insecure that even when his wife would go to the washroom, she had to keep the door open because he could not tolerate that he would be left alone. He always wanted somebody by his side. He was so insecure. So then we started talking to him, and he said that, listen, I'm going to die very soon. And he was a Hindu. So he said, once I die, who is going to light up my pyre? Means this is called Mukh Agni. In Hinduism, the son is supposed to light the pyre of the father, at least, if there is a son. So he said, who is going to light my pyre when I die? And that was his concern. So then we started talking to the family, then we talked to his son, and the son finally agreed and he came back home. And the father was so pleased. So this gentleman died about 35 days later. But those 35 days were very peaceful for him because his religious pain had been taken care of. Religion and religious traditions serve two main prime functions as far as palliative care is concerned. They provide a set of core beliefs about life events, right? Like, why am I suffering? What is the reason of this suffering? And how does my religion explain it? Every religion has certain ways of explaining why you're suffering and why and what can be done to alleviate this suffering and so on and so forth, right? And it also helps in establishment of an ethical foundation for clinical decision making. Say, for example, if a religious practice says, say, for example, in Jehovah's Witness, they would not want a blood transfusion. They would refuse an organ transplant also. So accordingly, that would provide us with a ethical foundation for clinical decision making. Yes, that's right. Yes, the patient and or the patient's relatives have refused such and such thing based on their current religion affiliation, current religious affiliation. So that is how religion can help in palliative care. Religion also helps to cope with stress. And I'm sure all of you would agree to that. Most of you who are religious must have used religion to cope with stress. 9 out of 10 hospitalized patients use religion to cope. Over 40% of people say that religion helps to keep them going. It is basically a fantastic type of stress buster. It acts as a buffer against depression and speeds recovery from emotional disturbance. It is associated with positive emotions and a good quality of life, related to lower rates of alcoholism, drugs, crime, and better school grades, actually. Religion. Related to healthier lifestyles and fewer risky behaviors. You have greater marital stability, enhanced family relationships, more social support, and use of fewer healthcare services. Now, the golden question, does religious attendance prolong survival? That means that if you are religious, would you live for a longer period of time? Actually, yes. The study by Harold Koenig in Gerontology 1999, older adults, particularly women, who attend religious service at least once a week appear to have a survival advantage over those attending less frequently. That means people who were more religious actually lived longer. Right? Actually, 7 to 10 years of additional life they had, which is so very significant. It also slows the progression of cognitive impairment and is associated with less functional disability with aging and faster functional recovery after surgery. So religion scores a big positive in almost all fields. Less stress-related medical conditions like lesser number of heart attacks, strokes, hypertension, so on and so forth. So it is actually helpful to be religious. Okay. Now, what exactly is religious coping? So whenever that's the classic example is before an exam, when you go to a religious place, a temple, a mosque, or a church, and promise so many things that please make me pass, or please give me first division, and I promise to do this, I promise to do that. So this is a very simple example of religious coping, So efforts to understand and deal with life stresses in ways related to the sacred. Religious coping serves multiple functions like search for meaning, identity, like, you might say, what is the point of living like this? And then say in Hinduism, you have the karma theory, which says that, yeah, as you reap, you will sow that. Whatever you reap, you will sow. So identity, intimacy, control, right? So religious coping, and every person would use religion to cope in their own, special manner. So this was a lady, she's no more now, and I used to help her make a sense of meaning, or give her suffering a sense of meaning and purpose, right? And this photograph was taken just a couple of days before she finally passed away. So again, coping, and how you can use religion and how you can use social events also to help in coping with stress. Like, celebrating anniversaries, birthday parties, and celebrating life per se. And this was taken in our hospice way back, I think in 2016, 15 or 16, during a particular study with the elderly. Here again, you can see this, this lady who is sitting out here. You can see there's a huge distension in her abdomen, right? So she had a huge malignant tumor, and she actually came all the way from Agartala in Tripura. She flew all the way to Calcutta because this is her daughter. Her daughter was pregnant at that point of time. So it was her wish to hold her grandchild at least once in her lap before she finally died. And this is an example of spiritual pain, because she was struggling to give her suffering a sense of meaning and purpose. And she felt that I am going to die, but before I die, I would at least like to hold my grandchild in my lap before I finally die. So this is the whole meaning of my life. And that is why she traveled all those distance. She came to Calcutta. She stayed in Calcutta for almost a couple of months. She was in severe pain, nausea, vomiting, and our palliative team helped her to, make a sense of meaning and help her cope physically also. And finally, we did make it possible for her to hold her grandchild. And a few days later, after this photograph was taken, she finally passed away. But then she died with a sense of completion. Her death was sort of complete. Now, there are certain behaviors that erode patient dignity, because when you talk of spirituality, when you talk of religiosity, and then dignity and self, your self-care and self-esteem, those things also come in together. Relationships of inequality, or being treated like an object or without respect. This is where all these things can generate spiritual pain, or wishes not being honored, that you are saying, no, you have to have this porridge. You have to have this dalia. The patient doesn't want to have it, but no, you're saying, no, I have cooked. So I've got up at 6 o'clock in the morning and I've been cooking for 2 hours for you. And now you don't want to have it. You have to have it. So basically, these are situations where you are forcing the patient to do something which the patient doesn't want to do. You are basically looking after your own wishes rather than honoring the patient's wishes. Or when there is a loss of control over bodily functions. like, where the patient, passing stool, passing urine in the bed, and that being cleaned by a daughter or a daughter-in-law or a son or a son-in-law, right? It's a matter of shame. It's a matter of shame, personal shame, basically. There is a loss of dignity. You wouldn't like it. Would you like yourself to be cleaned up, to be naked, lying down in front of your younger children, or being cleaned up by your children or your close relatives? So these are actions which erode patient dignity. Loss of ability to choose, dying in pain and alone or isolated. Would you like to die alone? Who is going to sit by your side when you are dying? Who actually? Who? People actually celebrate the fact that their children are so qualified, that they are studying abroad and so on and so forth. And what happens when you die? Or when you're on a deathbed and they can't come? Who is going to take care of you in your last days of life? And what plans do you have for that, for addressing those concerns? And when there is a loss of meaning or purpose in life, again, loss of meaning, loss of purpose, what is the point of being alive? What is the point of earning so much money and I can't spend it also? Right? So these are certain factors that should be addressed as soon as it arises in your mind. And if you have crossed the number of 50, age-wise, I think that it's high time. Because by the time you have crossed 50, you have already lived 2/3 of your life. Right? You just have 1/3 technically left, if everything goes well. So what are the characteristics of spiritual suffering? How would you know that a patient is suffering spiritually? Where there is pain, constant and chronic. You're giving your best possible drugs. You're addressing every aspect of pain, of physical pain. But yet the patient comes back and says that, no. I still have pain. I can't sleep. I don't feel well. There's that. That time you think of spiritual suffering. Presence of insomnia, that the patient can't sleep at all. Withdrawal, depression, guilt, self-loathing. He might say, no. Basically, I'm a very bad man. Or I am a very bad person. That is why that is why God is punishing me, and that sort of thing, Or having conflict. He constantly fights with all the family members, fights with his friends, a sense of hopelessness and despair that no, nothing can happen now. I am finished. The road is finished for me. Nothing is going to work for me. Lack of a sense of humor, unforgivingness, presence of despair, fear, or dread. And then we have certain universal spiritual and existential needs. Everybody, all of us. The need for love and authentic connection. The need to understand and transcend suffering. The hope to find refuge or a source of peace. And the need to find a meaning in life. This is something which all of us want, right? These are our universal spiritual needs. And this is my guru in palliative medicine. This is Professor Uchak, who passed away in 2019, from whom I learned the art of palliative medicine. It is just not a science. Palliative medicine is also an art. And then this was one of our patients who again wanted to hold her great-great-granddaughter in her lap before she finally died. And this was taken way back in 2011, this photograph. So, will we die in a manner consistent with the way we lived, which respects our personal values, spiritual beliefs, cultural background, and preserves our dignity? How are you going to die? Where are you going to die? Do you have any choices? Can you make certain choices about your place of death? Where would you want to spend the last days of your life? So these are very important questions. And these are very spiritually profound questions. These help to exercise your spiritual domain as well. Now, this is an example in our rural hospice. My hospice is situated in a rural setting. We have a team which goes out daily to the surrounding villages to look after the elderly, the incapacitated rural elderly. And this was one such couple, and so many people standing around, but none of them are concerned with the family, basically, right? So it is basically this elderly man and his wife. Now the wife has severe disabling arthritis, right? She can't actually get up on her own. So the husband used to catch hold of his wife and take her to the nearby washroom when she wanted to relieve herself. But gradually, over the last few months, the husband became totally blind. And now there is nobody to actually take the wife to the washroom because the husband can't see anymore. So now what she does is that she just lifts her sari and relieves herself through this charpai, through the holes in the charpai. So have you ever wondered that who exactly is going to look after you when you are bedbound? And what plans do you have for yourself when you are going to be bedbound? Because most of the studies actually have shown that the last 2 years of life, if you are dying of old age, for the last 2 years on an average, it can be more also, you would require the help of somebody for activities of daily living, like going to the washroom, like cooking, like putting on your clothes, for drinking water. You would require the help of somebody else. Now, the question is that who is going to do that for you? Because your spouse might be dead at some point of time. At some point of time, you will be all alone. So have you ever thought of that? And so what plans do you have? Spirituality is an essential component of each person. As I said, it is the built-in software. It is an ongoing issue. Readdress it over time, because there could be a spiritual concern in me today. But that doesn't mean that if that is addressed, that I won't have a new spiritual concern tomorrow. So spiritual concerns can come and go, come and go. Demonstrate respect for patients' values, autonomy, and vulnerability. Do not impose your own brilliant ideas on the patient, because it is the patient's own belief system which needs to be respected. And then comes the patient's family, right? Most important is to know yourself, because you cannot pour out from an empty glass. To give somebody else water from your glass, you have to fill up your glass with water first. So to give love to somebody else, first you have to learn to love your own self. Do you love yourself? So that's $1 million question. Think about it. Do you really love yourself? So knowing yourself is the first step. You have to understand yourself. And for knowing yourself, I had also gone through the same process. Physician, heal thyself. First, we need to heal ourselves. We need to fill up ourselves with love before we can transfer that love to others. And I went on my own journeys of, seeking to understand meaning, purpose, life, existence, so on and so forth. Various places and over the various periods of time. And this is our center, and that's Karen. She lives in Australia, and she had come down to our center for a retreat session. And then we have our inherent spiritual resources. Everybody has a capacity for love and authentic connection, capacity to understand and transcend suffering, the capacity to find a refuge or a source of peace, and the capacity to find meaning in life. All of us have this capacity, and we need to nurture and express this capacity to the best of the ability so as to help the patient and the family. This is not science which I'm talking of. This is something which is inbuilt within you. You just have to nurture it. You have to nurture it, water it, give it manure and let it grow, let it blossom. And you can do it. And this was one more patient of mine, and she would not let me go. Like as I used to get up to take leave of her, she would just keep on grasping my hands and she would implore me to sit down for some more time and some more time. And here again, a young boy with cancer of the anal canal. He used to study in Bangalore, and then when the cancer was discovered, he had to come back to his native village. And if you see in the background, again, there is a Trishul. So you can find the evidence of spirituality and religiosity all around you, provided you look for it. So people voluntarily, involuntarily, they always resort to religiosity and spirituality for support. Now this was another gentleman, C.A. Lung. He was a Muslim gentleman, you see. And now if you look carefully, see the same, I've zoomed in now. This calendar is in Urdu out here. But here you see some literature, again, which has certain tantric, Hindu tantric literature is also there. So when you are actually dealing with suffering, when you're trying to make a sense of meaning and purpose out of your suffering, sometimes religious boundaries don't matter, you see. It doesn't matter, because what you're seeking is basically to find a sense of meaning, or to make a sense of purpose out of your suffering. This is Adi Guru Shankaracharya from Hinduism, from the Vedanta type of philosophy. And he had said, Jantunam Narajanma Durlabmata, because in Hinduism we say that, we are the rebirth, we are born and again. And he had said that this human birth of yours is very precious. Why is it precious? Because out of all the living things, it is only the human birth, it is only the humans which have a sense of discrimination, which is good, which is bad, that only human beings have amongst all the living beings. So that is why human life is very precious. And he said, please do not let it go waste. Right? In Hinduism, again, if you go to the Bhagavad Gita, you have various things about how to die, how exactly, especially in chapter 8, it is very well written, what practices you have to follow at the time of dying, at the time of death and dying. So I won't go into the details here. And the Hindu philosophy again says that the body is made of 5 elements, and once you die, all these elements, go back to their individual native sources. There are many religious practices in each religion which needs to be respected and allowed if the patient wants that. If the patient wants it, it is not for you to impose. Remember that. Please do not impose your views. Whatever it is the patient's desire or the family's desire, and if the patient so desires it, then only you permit it, or you can facilitate it. That's it. In Islam also, you see, it's said that when the believer is afflicted with pain, even that of a prick of a thorn or more, God forgives his sins and his wrongdoings are discarded as a tree sheds off its leaves. Right? In illness, seek Allah's help with patience and prayer. Increase remembrance of Allah to obtain peace. Ask for tawbah. Give more in charity and read or listen to the Quran. So all these prescriptions are given in every religion. In Christianity, sin and death are the predicaments from which we seek salvation. Our predicaments are ontological. The cure of this predicament cannot come through human power alone, and the power of God can help. So everything cannot just be tackled by human beings. So the power of God can help in such situations. Now, religion can have certain downsides. The most important downside is that high religious coping receiving more aggressive end-of-life care. That people who are very religious would want to preserve their life at all costs. They would say, no, 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 put me on ventilator and so on and so forth, put me on advanced life support measures and so on and so forth. That is one possible downside of being more religious. Now, this is an example out here. This lady who you see lying down on the bed, she is clearly dying in the last stages of life. And she, when she was young, she used to sing beautiful songs, Rabindra Sangeet. And then this is our volunteer team with the keyboard. They came in and they started playing the keyboard. And within a few minutes, this lady got so emotional that she actually started singing along with the team. So we can use various other modalities to bring out those spiritual and religious aspects, like singing, because music is a very powerful tool. Then light massage, aromatherapy. So these are again other complementary things, like in you have some bhajans and kirtans in Hinduism. So that increases the religious tempo also. That helps to find a sense of purpose and meaning. So there are so many things, so many tools which are very unique to each religion, which you can use very fruitfully, provided again, as I said, as before, that the patient wants it. So how exactly would you do it? Now, there are various scales which are recommended in the European literature, so many tools to recognize religious suffering. But personally speaking, I do not use any particular toolkit as such, because I don't want to make mathematics or a scientific fiction out of something which is much more beautiful than that. Because spirituality is something so beautiful. So it's like a beautiful flower. And then if you put in a scientific tool in that, you make it so dry and tasteless. It has to be savored the way it is. It is a beauty in its own. It is so complete without its mathematical and numerological figures which you attribute to it. So for me, a scale I do without scales. But then, of course, you need to go back and look up into the various scales which are there to measure religious pain or spiritual pain. So basically, how do I do it? First is to recognize the suffering by talking, by listening, by your active presence. You have to go down to the patient. That is very important. Sit by the side of the patient. First sit, acknowledge, send out your vibrations of receiving. Recognize the suffering, respond with feelings of empathy, being a compassionate presence. You don't have to do everything or anything all the time. You just can go and just sit. You don't even have to talk. Your presence means a lot, because when a patient is actually entered the dying phase, he or she finds it very difficult to even speak. Speaking becomes a big exercise for the patient, right? Presence is awareness and kindness. Just your physical presence. Presence is awareness and kindness because you're responding, because the very fact that you've gone there shows that you care for the patient, and that is your kindness. Shift from doing to simply being. You just have to be there. View the patient as a whole with the suffering as only a temporary layer. Right? The patient, always have a photo of the patient when the patient was healthy and young by the bedside of the patient, because what you're seeing, what you're seeing right now today is a diseased body, is a dying body, is a withering body. But the patient was not there like that all the time. The patient at some point of time might have been young, healthy, full of life, right? So you have to, come to terms with that figure also and talk to that figure. And most important is authenticity. Acknowledge your own fragility and mortality. Remain available and present. Please do not abandon the patient. When physicians deconstruct suffering to its physical dimension while ignoring the psychological and spiritual pain, they not only fail to relieve suffering, but compound it. So unless you address the psychological and spiritual pain, you're doing nothing. Bodies do not suffer. The person within the body is suffering. And modern medicine only treats the physical body. It often fails to treat the person within that physical body. So this photograph, and this gentleman you see, who is sitting on this charpoy, he comes from a very conservative family from northern part of Bihar, right? And this is his wife. And if you notice carefully, she just has one leg. This leg has been cut off here. Osteosarcoma, metastatic, very advanced cancer. And we were sitting right in front out here. And this behind this lady is his daughter-in-law. Now, we had just, talked to him, and we had just told him about the prognosis, that she doesn't have very much time left. And just look at his expression then. And his hand actually went to the feet of his wife. He would never do this otherwise. Touching the feet of his wife in front of so many other people and in front of his daughter-in-law also, he would never do it. But now he's doing it because he's not even conscious what he's doing. Because he has just been broken, he's just been given the bad news that his wife is not going to live for a very long time. So out of a sheer sense of, he literally broke down, and in an effort to literally cling on to his wife, his hand went to the feet of his wife, as if he was trying to hold on to his wife, that no, I'll not let you go. So this was a clear example of a spiritual pain again. A beautiful example of a spiritual pain. And this again, spiritual pain, she used to have end-of-life dreams and visions. She used to see dead people by her bedside. I'll not go into the details of this because this is something, it's a totally different topic. So here again, she stopped seeing those dead people after we started talking to her, and she took recourse to religion and chanting the God and chanting God's name, and she could come out of that. This again, another example of spiritual pain. This was a young little boy with advanced lymphoma. So all his little life, however long he lived for hardly 5 years of age, till 5 years of age, and 5 or 6 years of age, and all his life was spent in hospitals. And he used to watch all the other children go to school. And that was his wish. He wanted to go to school. But by the time he was referred to us, he could no longer walk. He was confined to a wheelchair. But his wish was that he wanted to go to school. So we gave him this huge watch, and we talked to a local, nursery school, and the principal agreed that, okay, you can bring him in. And we gave him a tiffin box also and a school bag. And he went to school in this wheelchair only. And he used to sit in the last bench, and he used to eat his tiffin out there. And he used to make certain cartoons, drawings, sitting there. He couldn't sit for very long. Hardly 1 hour he used to attend the school. And he could only attend school for about a week before he became too sick. And these are the little drawings which he used to make. But that was his that was his spirituality. That he wanted to go to school, and that was his dream. And we could make that happen. So his spiritual pain was that he could never go to school, and that pain was adequately taken care of by sending him to school in an appropriate manner. So, and this is Dame Cicely Saunders, and she had coined the term total pain, in which you see, whenever a person is suffering from pain, especially chronic pain or terminal pain, that pain has 4 components. The first being physical, then social, psychological, and spiritual. And mind you, physical pain only accounts for around 25% of the total pain. Only 25%. So just by giving drugs and medicines and poking needles and doing this and doing that, you're just tackling 25%, mere 25% of the pain. But 75% of the pain treatment is by treating social factors, psychological factors, and spiritual factors, which really don't need medicines also. It needs you as a human being, as a compassionate human being, by your compassionate presence, your dedicated presence. You can make it happen out there, treating total pain. It is up to you. So religious pain means feeling guilty over the violation of moral codes and values of a particular religious tradition that I have violated. I never used to go to church. I never went to the masjid to pray. I never did my namaz. And that is why God has punished me by giving me cancer. So that is a classical example of religious pain. Spiritual pain means those who have concluded through their own self-judgment that there is something wrong with them at their core. That basically, I am not a very good person. That is why I have got cancer. So that sort of attitude is what spiritual pain is consisted of. And then there was another example of spiritual pain I'll give you. This lady with this huge cancer and all, so many growths. And we took care of her. Physical pain was gone, but then she still used to remain so very depressed. She had a small kitchen garden, and every afternoon she would sit on a charpoy and with a bunch of stones, because in those areas monkeys come. The monkeys would come and steal her vegetables and destroy her vegetables. So she used to throw stones at the monkeys, and the monkeys would run off. Now her main worry was that after I die, who is going to throw stones at the monkeys? Because that little kitchen garden was something which gave her a sense of meaning and purpose. That was her spirituality, that kitchen garden. Right? And that monkeys destroying it was her spiritual pain. And then we asked her daughter-in-law to come and promise her that, don't worry, even after you die, I will take care of the garden and I will ensure that no monkey comes. And only then she was at peace. And this is this is the kitchen garden. And she's smoking her hookah. See, she used to sit in this charpoy, and that is the kitchen garden. So that was a beautiful example of spiritual pain again. And hope. We should not take away hope. That doesn't mean that we should encourage false hope, right? So hope, you need to preserve hope, but in a meaningful way. Do not give false hope. So I think I'll end my talk. And if there are any questions, I would be happy to take them. Thank you.
Thank you so much, sir. Actually, it was quite interesting. So I think Ravikant having some questions. You can unmute Ravikant and you can ask.
Good afternoon, sir.
Good afternoon.
It was really an enlightening talk, I can say. Speaking about spirituality is something very sensitive as well as very interesting, and many times as a therapist or as a doctor, people may ignore for certain reasons. So, but this is something is very important in everyone's life. I think the saying which goes like Adhyatma Vidya Vidyanam, the true education is that the spiritual knowledge, but the distinction between spirituality and religion is always a thin line, and people do not make it point to understand the nuances. So this is something I have a question here. The thing is how we can introduce the spiritual component into a therapy or something as a counseling component. So any something could you say how we can sensitize this aspect? Uh,
Okay, whether you want now sensitizing this aspect as a part of teaching new people, or sensitizing this aspect as a part of therapy for your patients.
both, because in the teaching field as well as the teaching field means, for example, I teach psychology sometimes. So the thing is how we this module can be integrated and any certain aspects.
See, the whole purpose of this module, what we discussed today, was basically to, enlighten all of us and to the concepts of spirituality, religiosity, and their clinical application as well. And that is why I gave so many examples. And you see, as you keep on talking to patients, as you keep on talking to other people and patients and their relatives and listening to them also, gradually so many newer facets keep on adding. Because till today, I am also a learner. I keep on learning also. So there is no end to it. There is no end to learning. And as far as teaching other people are concerned, this module is a classical example of how we can begin the teaching aspect. And treatment aspect is, I can't give you a clear-cut guideline, because every person is unique. Every person is unique, and every person's needs and belief systems are different. So every time I go, even today, every time I go to see a new patient, I begin with first listening and observing their household, observing the patient's families, listening to both the patient and their families, and then only we take back that information, reflect upon it, if necessary, discuss it with your two teammates, and then we can come back with a good plan of action. But the most important tool is active listening. You have to be an empathetic and your compassionate presence and an empathetic listening. That is the most important therapeutic tool.
So no, when it comes to asking any questions related to the client spirituality, so how the questions can be framed? So anything.
Okay. So you can simply ask by, do you have any pain now? Or did you sleep well last night? Or you look sad today. Why are you looking so sad today? Like open-ended questions, sort of. So, or did you eat today? And he might say, no, I don't feel hungry. And then you might ask, why, till yesterday you used to eat, and why are you not feeling hungry today? And then gradually you just leave those things like, hunger, food, these important life-sustaining points is where the spirituality and religion intersect. So a person who is depressed, for example, or who can't sleep, that means he has been thinking about something the whole night. Something has been disturbing him. So finding out, instead of asking him, oh, what were you thinking of? You might, a polished way is like, did you sleep well last night? Or why couldn't you sleep well last night? Or, that sort of thing. Or the patient might be giving you an indirect clue also. He would, like this actually happened to me. One of my patients told me that, doctor, I'm thinking of getting my daughter married off next year in August. So basically what he was asking me was that, will I be alive till next year, August or not? That sort of question. So the patients are also very clever at times. So you need to actually, because as I said, there are no clear-cut guidelines as such. You need to just keep on building up that way.
Definitely, sir. Thank you so much for the.
Thank you.
Any more questions from anyone?
Doctor, will you please, you are unmute the video session, so we could not see your face at least.
Okay. You want to see
Very
my
quickly.
face? Not a, okay. I'll just put it on. Yeah, there I am. And I hope I'm visible
Thank you.
to everybody now.
Yes, thank you.
Good afternoon. I have a couple of questions.
Yeah, please.
Sorry, my video is giving me trouble. Initially, you said that physicians' own belief system, whether spiritual, religious, or none, affects medical decision making, consciously or unconsciously. Can you elaborate a little bit on that?
Yeah, say, for example, if you are an atheist, right? Like I was till almost 10 years back. So I would not focus much upon those other aspects. I would basically be focusing more on the physical aspects of the disease. I would be speaking more in terms of ventilator settings or IV fluids or drug therapy or chemotherapy. Have you taken this drug at this point of time or not? Or if the patient would complain of pain, then I would just respond by increasing the dose of painkillers rather than looking laterally, trying to find out whether other facets of pain have been addressed or not, whether the cause of pain was his loneliness or his suffering or the loss of dignity and so on and so forth. So that is how the physician's own belief system would, because what you believe in, basically, the way you're wired, also decides how you respond, So this is what I basically meant when I said use that statement, right?
Okay,
so, and if you are a believer, then you would naturally, if you believe in something, and or if you have seen the good effects of that, or like simple things like prayers. Many patients request, or the relatives request, that they would like to come into the intensive care and pray for the patient. And if you don't believe in prayers and all, you would sort of discourage them or shoo them off by stating various reasons. So this is where the physician's own belief system or the way they think about it can affect medical decision making.
Yes, thank you, doctor. And the second one that you mentioned soon after that is you were talking about choosing where to die. How can you make the choice possible of choosing? Like you said, like a lot of people, a lot of us will die in a ICU bed. Of course, none of us want that.
Yeah.
But it's not always easy or to like I definitely wouldn't want, talking personally, and neither do my mother-in-law who's 92. So I have relatives who don't want to, but it's not easy always to make that choice of me choosing where I want to. So how do you address that?
Yeah, because in a recent judgment by the Supreme Court, which is very recent, and the government, the Supreme Court has given a judgment in favor of advanced directives. And these advanced directives are very much in vogue in the Western civilization, where you can actually put it down on a pen and by pen and paper, that this is how I would like, suppose I'm ill and I cannot take decisions, and suppose I suffer from a stroke, or I'm in a coma and I cannot take decisions by myself, then please do not put me on a ventilator, or please let me remain at home with nursing care at home. That sort of choices, you can put it down on pen and paper, and those will be respected. Right? Those are called advanced directives. But if those advanced directives are not there, suppose tomorrow, if you suddenly slip into coma, the immediate response of your relatives would be to rush you to the nearest hospital. And the hospital people would put you in the ICU and on a ventilator, right? Whether you like it or not.
Yeah.
So what is important is that your choices should be expressed to your immediate relatives, or if you don't have any immediate relatives who are not interested in listening to you, you can express those choices to your nearest friends and put it down in writing, right? So those are advanced directives, and it helps us having a what we so-called call a good death.
Okay. Thank you.
Thank you.
Hello, doctor.
Hi.
I have one doubt. So this advice directive have any like legal authority? Because if I want to write an advance communication, and will it consider as a legal document? Because my family think that when I'm in coma, my family think that that's just a paper and a pen and paper. So they won't agree it.
So this has got a legal implication now that the Supreme Court of India has actually authenticated it. Although still there are some loopholes in this, but all said and done, you can put it down on a piece of on a paper and get it authenticated by a judicial magistrate of the first class, or even a gazetted medical officer, who would state that, yes, the day you have done this, you were in your full mental capacity. That means you were not drunk, or you were not under the influence of any other drugs or whatever it is. You were in your good mental capacity. You were not crazy or insane. And you have done it out of a good sense of judgment only.
Okay.
So that is done now.
Okay. Yeah. Thank you.
Thank you.
Any other doubts or queries?
Just coming back to that advanced directives, it has to be some from authorized personnel, right? It can't be just a wishes of the, say, a 92-year-old woman or a
92-year-old woman is absolutely entitled to put in her thoughts. It just has to be authorized, not authorized by countersigned. Countersigned means basically that you have made this wish in the presence of this person. That is it. A registered medical practitioner also can act as your witness out there. Witness to that statement. Right? Or if you think that, no, I cannot put in my advance directive, but in case I slip into coma, my husband or my whoever or my son-in-law can take a decision on my behalf, and his decision will be considered as final. That also you can do. This is called a surrogate medical decision maker. So in case you think that, no, I don't know whether I can take a medical decision for myself, or if I'm in coma, then my, designated surrogate decision maker is such and such. That also you can put.
Okay, so any more queries? Okay, I think everyone get knowledge about the session. I think spirituality is a very vast subject. So we can't like from your session, what I get is it's not to be done in one phase or one day or something. It takes a long time, and there are so much procedures after that and before that. If anyone has any queries or something, you can just put it in the chat box, or else you can just contact via mail or queries. Okay. So I think we can end the session.
Thank you, Dr. Abhijith, for joining us. We do know that this session was actually pre-pod, if I could say so, and you were kind enough to join us today to enlighten us on the aspects of spirituality and religiosity. Thank you so much. And those pictures which you showed, they were speaking for themselves, I believe. Very carefully chosen, and one picture spoke 1,000 words. So thank you so much for enlightening us, and thank you everyone for asking those relevant questions and making this session interactive. So with a positive note that we will see you in the next session with another interesting topic and yet another eminent faculty. This is Sri Priya, along with Dr. Abhijith Dam and Mr. Sharad signing off from the Tipsy Hub. Till the time we see again, take care everyone, stay safe, be happy, bye-bye.